Next, let's go to the United States, where the US President Donald Trump has signed an order that's calling for fewer childhood vaccines. The move is controversial because it flies in the face of consensus among medical experts and could put children at risk of contracting preventable diseases. It's also then a victory for his health secretary, Robert Kennedy Jr., who's long been an anti-vaccine activist. Well, let's speak to Philip Turle about this, our international affairs editor. Philip, then just explain to us what it is that Donald Trump has signed.
Well, basically, it's to try to push the American people to vaccinate less their children. What Donald Trump is saying here is, well, we're offering a choice. We're not forcing vaccines on people. If you don't want to vaccinate your children, you can do that as well. What they're saying is they're separating the MMR vaccine, that's the measles, mumps and rubella vaccine, which is administered in one shot, saying it is more preferable if those vaccines are administered in 3 separate shots with 3 separate visits to the doctor. And they say that there is also a plan to reduce the total number of vaccines that are administered to children in the United States from 18 down to 11. Now, President Trump, during that signing ceremony in the Oval Office, was asked about the evidence which was put forward to him, saying that it was a good idea to reduce the number of vaccines given to children. And he just basically said, well, I've heard that some people say, without giving evidence about who those people are, that it's lethal. I've heard that when you put them together, they can be explosive, and then comparing that to pouring soda into a child's body. Just to underline this, there is no evidence, of course, and the figures show in the United States that as a result of vaccines being less administered over recent times, there's been a 35-year high in the number of measles cases in the United States so far this year, high up until the month of July, almost at the same level as the total number of cases for 2025, and also the fact that 3 children have also died as a result of measles in the United States for not having been vaccinated.
Well, let's talk about this link, this alleged link between vaccines and autism. That is something that the president mentioned there, but it's been debunked, hasn't it, by medics?
Yeah, they say that there is absolutely no evidence to link autism to the fact that people are being vaccinated in the United States. There are more cases as a result of that. Most experts say that the rising cases of autism can be primarily attributed to 3 factors, and those 3 factors are, first one, changes in how the condition is diagnosed, greater knowledge of what autism is today, and the condition of it, and the third one is that more people are being tested for autism. And of course, the more people you get tested, the more cases that will be discovered, and that means the figures will go up. And that's what's being used by anti-vaxxers, saying, well, look at this, we have more cases of autism as a result of these vaccines. There's no link that's been worked out between the two, and that's why we need to slow down on the number of vaccines that are being administered to children in the United States. I'll give you an example of that. One of them was in California, where Donald Trump says there is evidence that the number of cases has gone up a lot in the last few years. In 2022, the US Center for Disease Control and Prevention estimated about 1 in 12 8-year-old boys in California had autism. That's the highest rate for boys in a study across 16 US states. But then the CDC said that California had funded a local initiative training for hundreds of local pediatricians to screen and refer children for assessment as early as possible, which could result in higher identification of autism and the conditions, and which is why we've seen this increase in cases there. So all of this is being counterbalanced by the Trump administration saying this is evidence to show that autism is on the rise in the United States as a result of vaccines.
And look, what's the reaction been from medics to this idea of Trump's that children should have effectively fewer vaccines?
Well, I'll give you 3. The first one is from the president of the American Academy of Pediatrics, Dr. Andrew Racine, who said that Trump's executive order is dangerous, not based on any gold standard science. Delaying or skipping shots is risky, especially as measles continues to spread and children go back to school. Senator Bill Cassidy, who's a Republican, he's also a physician. He was one of the deciding votes in the Senate to confirm Robert Kennedy as health secretary. He said the president does not have the expertise to make these changes. Vaccines are overwhelmingly safe and effective and do not cause autism. And just one other point, a Danish study in 2019 followed a group of about 650,000 children and concluded that the data did not support that the MMR vaccine, the measles, mumps and rubella vaccine, was the cause or trigger of any form of autism.
All right, thank you very much. Philip Turle for us there.